So as Dawn mentioned, and as you probably heard, February is Heart Month. Not only just because we just passed Valentine's, but it is a campaign to raise awareness about cardiovascular health, and above all things, to raise awareness about heart disease and what can we do so that it does not affect our life. Or the core of what we want to do today is not just your heart, but the heart of your loved ones. So after Dr. Kraft and I discussed a little bit and what we know from our practice individually, but also as being members of communities, we really want to have this to be an engaging conversation. So we have some talking points, and we're also going to ask some questions to you that you're going to chime in through the chat box, and hopefully too, if we have time, we can give you opportunity to have those questions answered tonight. And if not tonight, we want to make that commitment to answer those questions in the future. We will be connected via email. This information will be shared with you, as well as my personal contact information, so that you connect with who and the resources that you need. What better, right? To have a friend in St. Luke's that's named Glorice, and a heart specialist that's named Joe. So we're going to start today with kind of this question and a reality that COVID-19 has affected our life in many, many ways. But we also know, doctor, that there's a correlation, or is a virus that really can have a negative impact on our heart. So research indicates about 27% of Americans diagnosed with COVID say it has impacted their life. So before I ask you to share with us some experiences from your practice, I'm going to ask our audience, simple question, yes or no? Has COVID-19 impacted your life, your heart health particularly? And as I see some yeses coming by, doctor, why don't you share with us a little bit what you learned from your patients, and then I'll ask some of our patients what our audience, what their experience has been like.
Yes, thank you. So this is still a very common topic. These are things that we talk about every day. I spoke with patients about this in our office just today. There are quite a few side effects, either immediately during infection of COVID-19 or in the months that follow, weeks to months that follow, where people have heart-related symptoms. It's really common for us to see reports of shortness of breath that linger, as well as fast heartbeats, lightheadedness, sometimes frankly irregular heart rhythms. Things like myocarditis, or an inflammation of the heart muscle, has gotten a lot of press, but really that's quite uncommon. More low-key, but sometimes nagging and lingering symptoms like fast heartbeats, lightheadedness, shortness of breath are the things that we see the most with COVID, and it really does affect a lot of people. Conversely, people who have cardiovascular disease to start with, even high blood pressure or diabetes, are at higher risk of getting COVID-19 and having side effects or complications from that. So it would be safe to say that COVID-19 and heart disease are interlinked.
Yeah. And so some of the comments that were coming through the chat box, doctor, is when you're saying yes in many different ways. One of the things that we know from, as you mentioned, from the news is, heart disease has been the #1 threat for our public health concern. And yet 2 years into COVID, there's a term that we use. It's not a scientific term. It's called pandemic habits. Have you heard that?
Yes.
So sleep, weight, stress, so many other things, that it all add a toll to how we and our heart is being impacted. So if you have cardiovascular disease, more so if you had COVID, you need to talk to your primary care doctor or a cardiologist. At St. Luke's, we have a wonderful affiliation with the Cleveland Clinic, and our Heart Vascular Institute offers a second opinion line that is a wonderful resource for any of you who may be looking to either get a diagnosis or to help you manage your heart conditions. Very good. So my next question is going to be directed to how do risk factors play a role? So you mentioned diabetes and high blood pressure. Let me see if I can progress my slide because I'm having all sorts of technical issues today. There we go. So why don't you tell us, doctor, a little bit about what's the difference between the traditional and the emerging risk factors?
So I suspect most of the audience has heard about the traditional risk factors, in my office, whether people have heart disease who come to see me or trying to avoid it. We talk about these things, sort of incessantly, and it's really valuable. So if you have diabetes or high blood pressure or a family history of heart disease, if you smoke, if you're overweight or have high cholesterol, these kinds of things, incrementally, each of those adds a little more to one's 10-year lifetime risk of a heart attack or a stroke, which is, of course, what we're all trying to avoid. If you have some form,
sorry to interrupt you, but I purposely didn't put one here, which is like unavoidable to all of us, which is age.
Well, right, you've listed modifiable risk factors. If somebody figures out how to modify age, I'd be interested to hear about it. But right, so each of these things, I guess family history is not really modifiable, but it's influential. That is to say that family history is not destiny. There's a lot of really good science to even show that people are genetically prone to cardiovascular disease if they had it in their parents or siblings. By living clean and doing all the right stuff, you can actually dramatically lower your risk, even if it is embedded into your genetics.
Yeah,
So
and it's something that we're going to emphasize a lot today in this conversation is owning, your health and your health history and your family history and all of the wonderful strengths that we carry, but also some of our weaknesses. I feel that when we talk about heart disease, some of us really want to highlight the things that we do really well, but the things that are difficult to change, we tend to look the other way. And so you said modifiable, non-modifiable, and there's many things just with commitment and sustainability, something like significant like family history, you can somewhat revert that destiny. Did I hear correctly?
yes, and when we see people do that, when we see people embrace healthy lifestyles and sort of own their health, it's a beautiful thing. They, generally speaking, lower their risk. Healthcare stuff should come up, and eventually we all have healthcare problems. The people who live clean lives and don't smoke and exercise, and they almost uniformly recover from those healthcare setbacks faster and more completely with less complications. So,
Okay.
living clean is not just, it doesn't just help prevent problems, but it really can turn future mountains into molehills, which we're all looking for.
Very good. And so this is why too I highlight, mental health is one of them that oftentimes we have a lot of stigma or hard issues recognizing that we may need support. And through this pandemic, I think it has shined a light on what much need we have for social support and also where to go for like reliable health information as well. So taking all of those into consideration. We also know that signs and symptoms are different sometimes of a cardiac event. Sometimes no, they are different for men and women. Can you talk a little bit about, oh, my heart hurts and then I just drop? Is that how it happens, doctor?
Well, we certainly see that, and it would be fair to say, to be totally clear, for example, if somebody were having a heart attack or a near miss heart attack, chest discomfort, central chest discomfort, is by far and away the most common symptom in both men and women, majority of the time. However, in many women, that may only occur 60% of folks. So that means that 40% of women, particularly women over the age of 65 or women with diabetes, may not have any chest discomfort if she's developing blockage in the heart arteries or having a near miss heart attack. Oftentimes, the symptoms might just be short-windedness or fatigue or lightheadedness or skipping heartbeats. And those things are often ascribed to other problems, like I'm just overstressed, I'm overtired, I'm out of shape. So it's not always a chest pain story, and we got to be thoughtful about that.
Yeah, I've oftentimes is known that women tend to delay care. I cannot speak for other women, of course. I just speak for myself. We multitask different priorities, and I have heard oftentimes that the symptoms can be somewhat, not so dramatic. And so people tend to put it out or put it off to seek care. So how important to be familiar and to shine a light on your awareness of what are your risk factors, what health conditions or realities you live with, and then the signs and symptoms. So this Be Fast acronym is well known, but it kind of touches base on how some of these signs and symptoms can help you reach help the sooner the better. Why is it so important to call 911 fast, doctor, if you think you're having a heart attack? Or
Yeah,
someone that you love is having some of these symptoms, and they may be overweight, and they may be, I don't know, have blood pressure or have diabetes or none of them.
well, we're blessed in this country to have a pretty robust emergency response network. It's not perfect, but it's pretty good. And in this Be Fast acronym is referring to symptoms of stroke. And it wasn't long ago when strokes were treated with a little bit more casual attitude or sort of less speed. And now I think there's a general acceptance in the healthcare community that those need to be, even possible strokes need to be treated like emergencies, and hence the 911 is the time. You know, if you truly are having a stroke, for example, or a heart attack, the lack of oxygen to the heart muscle or lack of oxygen to the brain, minutes really do matter. So we need to act on those things quickly. It's easier to act on those things quickly if you're familiar with the symptoms. So I think all of us need to just spend a little bit of time, maybe a few times a year, kind of reviewing the symptoms of heart attack, reviewing the symptoms of stroke, just to keep those things fresh in our minds, because every once in a while you will see a loved one or a coworker or a neighbor have these symptoms, and they may not recognize it in themselves, but we can act in on their behalf.
Yeah, I think it's always so powerful too. We think about ourselves, but also ourselves and those around us gives us even that much more purpose and reason to do better. So these are very like basic, but so important regarding heart health. So we mentioned a few, and in the handout that we're going to provide to our audience, there's some numbers. But do you want to, I guess, spend some time on thinking how, preventable some risk factors may be, and how, medication oftentimes is needed no matter how clean or how well you may be doing. At what point should someone talk to a physician about their heart health? At what point should they transition into a specialist?
Great questions. I think many people who've been to a doctor perhaps in the last year or two, have heard a lot of these things discussed. Sometimes it feels like doctors are just a broken record talking about blood sugars and smoking and exercise and all those things, but it is unbelievably impactful. I can't emphasize enough. The people who do these things right just have less problems. They get less tests. They have less medical costs. They see less doctors. They spend less time in the hospital. It is absolutely what we see. And that applies to people who've never had a heart problem and don't want one, or people who've already had something bad happen and don't want the second event to occur. You cannot emphasize it enough how valuable these things are. And that implies and means really that a lot of this stuff is influential. But it takes some discipline. It takes some time, organization. You have to be willing to change some habits, and sometimes that's not easy. We live in an era, this wasn't always the case 20 years ago. A lot of people come to me and say, gosh, I really don't want to take a lot of medicines. I want to minimize the number of pills. Well, this in front of you is effectively the cost of minimizing medicines, is living a clean lifestyle. And for sure, the people who exercise and don't smoke and eat clean, we see it. People come off medicine. It's really, really exciting. And most people like that. So I can't emphasize enough. I love, love, love prevention. It is so much more fun to talk about avoiding fires than putting them out. I can't emphasize enough how important this is. And it also goes back to a little self-love and self-care. And I think a lot of us have learned in the last couple of years, the power of taking care of oneself, or what happens if you don't. We talked about the pandemic and the mental health isolation and being more sedentary in front of computer screens and gaining weight, all of those things so many people experienced. Really, I think, to have a healthy, balanced life, both psychologically and physically, we gotta take care of ourselves and spend some organized, dedicated time doing these things.
Yeah, that's exactly on target. We like to, in community outreach, we do a lot of community health. And I was just thinking, as I hear you speak as a dietitian, oftentimes I have people that they really do not want to take medicine, right? As you say, very motivated, but they do extreme lifestyle makeover and it's wonderful, but it's just not sustainable. Or they do it really well for a couple of months and then we tend to go back to old routines. And this is always how it's a journey, really not a destination, to do this self-love and self-care. And at St. Luke's, we take a lot of pride on our ministry of healing, and it implies holistic healing, as you mentioned, the body, the mind, and also your spirit. So you have to kind of, and it's a juggle that we all have to go through all the time. Somebody in the chat was mentioning how COVID-19 has made them stay home more, and this has resulted in a less physically active life. And I think that hits home to a lot of us. I was going to ask our audience if anybody else wanted to share, I guess, in which way or which lifestyle approach you struggle most with. I want to say physical activity and maintaining a healthy body weight is something that many of us struggle with, just because we're busy, we eat junk food or it's easy access food, or we just don't eat well at all. So it's like one of the two or the three or the four wheels of life have to be on board. But taking it with self-love, by doctor's prescription, I think, is the takeout message that we're going to move along to the next slide. But I'm going to add here, with the pandemic habits, we know that is unique to each one, but in general, people have tended to be more isolated, less physically active, more with tendency to bad behaviors, such as eating more the wrong foods and engaging more in risky behaviors like consuming more alcohol. They say, well, happy hour at 7. No, let's do it at 2. We're working from home. So all these things now, 2 years into it, can have a toll. So don't let yourself go with the excuse that this is going to pass, because we know that these times are here to stay and we need to be flexible and adjust to what our life brings us, right? So you mentioned briefly about the correlation with heart disease and family history, and many people, as this slide shows, believe that if their genes are there, there's not much they can do about it. I think we emphasize, and you made a great point of, the cleaner, the better you live, the earlier you begin, the better for your heart and your cardiovascular health. Why don't you tell us a little bit, who needs to pay attention to family history? Or how does this tree of family risk go? Say, my great grandpa had a heart attack. Is that a risk factor for me? Or what do I need to ask in my family?
Great question. Generally speaking, a great-grandfather's medical history wouldn't be very translatable to most adults, in this day and age. But so we usually think of first-degree relatives, meaning siblings, parents for sure, sometimes even adult children. And if they have medical issues early in life, they may be related to things that we have and we haven't yet recognized in our own lives. So family history is important. Some medical problems are more heritable than others, and these are the kinds of things. There's a list of things that are sort of more readily heritable, and you'd want to talk to your own physician about specific things that may run in the family. But among those are heart conditions. To this slide, just to add a little meat to what I said earlier, there's one of my favorite articles to quote. There was an article in the New England Journal of Medicine a couple of years ago where we don't do this in in clinical practice, the coronary artery disease is genetically very complex. So we don't really, unlike some cancer problems, we don't draw people's blood to look at their genes to see if they're prone to coronary artery disease. It's just too complicated for this day and age. Excuse me, but in a research lab, you can do some of that. And this group of investigators found a relatively sizable group of people who had genes that had been identified that were tightly linked to premature heart artery blockage and bypass surgery and heart attacks. And they followed them for a period of years to see, and they asked them lots of questions about how they lived and what did they do, what was their exercise like, what was their stress level like, how did they eat. And it was very, very clear that even this group of people who all at baseline were genetically predisposed to having heart artery blockage at a young age, those behaviors, those cleaner living behaviors, made a significant difference in whether they themselves actually developed heart attacks or strokes. So it's really, really, I'm sorry to see that statistic. I'd never seen it, but I guess we need to be on a mission to prove to everybody that family history is not dead.
Yeah. Well, and also this is, I think, how younger generations, it's our role to shake up the tree and ask them questions. And once again, the sooner, it's never too late to begin this process of self-love. So if you've been a smoker, if you've been mistreating your body by eating fast food most days of your, doesn't matter what you've been doing. It's never too late to start somewhere practicing some of this self-love. And sometimes it just may be by talking to your mom or your sister or a friend about your concerns or about their concerns about heart health. Okay. So moving along, I want to ask our audience, did you know that high blood pressure is like the main focus of the 22 campaign for heart awareness? Yes or no? Do you know why? Anybody? Doctor? Why? Do all the American Heart Association, the CDC, the NIH, and all these medical organizations say, yes, we need to continue to shine a light about how important it is to check blood pressure and to know if you have high blood pressure to manage it?
This is something that I can't even tell you how much time we spend on every day and every week. It is so amazing. I recently saw some statistics just this morning on some specific patients in my own practice. This was data that was fed back to me, and looking at our own patients' blood pressures, and it's very, very challenging sometimes to get blood pressures under control. And the science is just overwhelming. It's just overwhelming in how much blood pressure over a long period of time influences nearly every heart condition I can think of. And really how impactful it is. And it's challenging because this is not something that you'd feel. Obesity, if you gain in weight, you often would see your belt size get bigger, or you'd feel it, you'd notice it. Most of the time, people have blood pressure elevations, they don't feel it. So it's easy to ignore. It's easy to be something that you wouldn't investigate.
Let me share a story with you.
Please.
I have been blessed to be super healthy most of my life. Like most people, I've had struggles here and there, but until pregnancy came into my reality, therefore, like walking around 30 pounds with extra weight, everything hurts. When you have extra weight, particularly your joints beyond your image in the mirror, right? With that aside, heart disease and high blood pressure and hypertension, I tell people that I work with, I check blood pressures a lot in the community as part of my job, and people get very defensive or upset when you tell them the reading, and I'm like, I'm sorry, I'm not the scale, I'm not telling you your weight, I'm just telling you what your heart pumping pressure is telling me. If it were to be a toothache, or hurt like a toothache, because I've had several of those, I think high blood pressure wouldn't be as bad of a problem as it is for our public health situation right now. They call it the silent killer for that reason. It doesn't hurt, but it hurts you inside slowly but for sure, I want to not miscredit heart disease because it is the most relevant, but uncontrolled hypertension is not only very common, but very dangerous because of heart disease, stroke, heart failure. But in addition to that, it hurts or it can put you at risk for kidney failure, vision loss, peripheral arteries disease, sexual dysfunction, pregnancy complications, and cognitive decline. Nearly 0.5% of adults in the United States have high blood pressure or have been prescribed medication for high blood pressure. So this is hopefully the highlight for everybody tonight. I don't care how old you are or if you have high blood pressure or not. We have this beautiful picture here of proper mechanics or ergonomics of how to check your blood pressure. So, doctor, what is your recommendation? Should people monitor blood pressure at home? And if yes, no, or and who should do it? What is your intake on this?
I don't think everybody needs to do it, but a lot of people do. More people need to, in my opinion, than actually do. The people who should consider that are folks who have ever been told they've had a high blood pressure once. Say it was they were going to donate blood and somebody noticed it, or they went to urgent care for a totally unrelated matter and somebody checked their blood pressure and said, "Gosh, did you know your blood pressure is mildly elevated?" Also applies to people who've already had heart trouble, or if they have other heart like I have high cholesterol or I have diabetes or something like that, they should periodically check it. Um, I think the slide nicely depicts what we tell people about how to check it. Sometimes I would say also that there is a group of folks who try to be the A students and check it a lot. And sometimes checking it a lot, we have some folks who are trying to do a great job, but they'll come to me with 6 or 7 blood pressures a day. That doesn't do anything but serve to drive it higher, drive the
Exactly.
anxiety of that problem up. So for most folks, even in our care who have established heart disease, if the blood pressure is controlled, I might have them just check it once a month or maybe even twice a month. We encourage people to check it, even though we do the process the same way. We sit in a backed chair, feet flat on the floor, bladder empty, sit quietly, rest for a few minutes. I encourage people, if they are doing blood pressure home monitoring, to do it at different times. So we'll have folks, as soon as they come home from work or even at work, check it, or perhaps maybe another time they'd check it first thing they got up from bed in the morning, or another time right before an exercise workout. We kind of mix it up. But if it's changing or if it's too high, that's usually when physicians, I think, ask for more numbers.
When we do wellness coaching or chronic disease management, one of the things that we like to, once again, own your information. One reading alone is just speaking of you at that one moment. So if you're going for a high blood pressure follow-up every 4 months or every 6 months, it may be wise to monitor maybe a week or two prior to your appointment, or have some sort of scientific method, not an OCD method, but some way to kind of assess what your range is and on different days, so that you can feed information to you to then better communicate with your provider. Some people are easily aroused by work or traffic or the snow, and blood pressure could go up and down, up and down, up and down a lot throughout the day. But you don't know if it's staying high or if it's where it is unless you monitor. So, where that plays according to your needs is very unique. And I think the good point is, if you are having issues with blood pressure, or your doctor's been talking to you about starting new medication and you're really resisting, it's good to have a quality blood pressure device at home, or have somewhere where you know that you could go and check it. Because as one of them is, if you're 40 years or older and you have a couple of these risk factors that we spoke about earlier, such as being overweight, or having stressful lives, or not sleeping well, or drinking too much alcohol, or many of the above, it may be wise to check it more often than not. If you have issues with mental health, or if you're taking medications for other things, your blood pressure may also be impacted as a side effect of other things. So When in doubt, if you're not feeling so well, it's good to have all of your players, in one card and be able to track it to help ease that anxiety and lead the conversation with your provider. Very good. Anybody in the audience have a blood pressure at home that they monitor with? People use smart devices, doctor. They use the finger, the thing. We usually recommend the arm electronic cuff to see, to have more engagement in the process.
Hey, Clarice, this is Dawn. Before you go on, you have one of the attendees has their hand raised.
Okay. And hold on, who is it? If you tell me her name, I can maybe unmute her.
E. Mallory.
Okay, here we go. All right, Mallory, I'm going to unmute you. We're going to test, see if we can have you speak in. And, oops, I can't, Dawn. Ugh. Can you see if you can unmute her? I thought I had the command, but I do not. Mallory, would you be so kind to text your question? Unfortunately, you're on a phone device and I cannot unmute you. Or I don't know why I can't unmute you. If anything, please submit your question, write it down on a piece of paper and email it to me, because my commitment is to get all of your questions answered today. Or if it's not today and the question comes out later, you have my contact information so that I want to be available to you whenever the question may arise, okay? So write it in a piece of paper if you can, and so that you won't forget. Dr. Kraft, the American Heart Association has put out this beautiful chart with different levels, so blood pressure can fluctuate. I want you to speak to, there's two numbers. Is one more important than the other? Because this is what I hear from my patients. Oh, my top number is good. My bottom number is the one that's giving me trouble, or vice versa. How do we interpret this?
That's a great question, and one we get periodically too. The answer is they both count. We tend to see trends in younger folks with high blood pressure, say folks in their 40s and 50s. We often see a disproportionately high diastolic, meaning the bottom number. Perhaps somebody comes in to see me with a blood pressure of 140/95, where the bottom number is a little bit relatively higher than the top. In folks over the age of 60, 65, and this is a normal physiologic change of aging, when we have higher blood pressure, the top number tends to be higher, or the one that's more out of range. And in my patient population, that's what we see more often, but they both count.
So remember, the heart has like chambers, right? And yes, there's two at the top, two at the bottom, and they measure pressure, and they're doing this all the time. So both numbers are important. And sometimes that's why when you check your blood pressure, when you go in the doctor, and then maybe the doctor will second check it again, because now you have been sitting there waiting for a little while, you may be calmer. It changes all the time, right, doc? So that's why it's good to be calm. And if it's off range, to maybe have a second check and discuss with your doctor what is your range of safety, and when is it your red zone? When is it that you need to stop and think about whether, corrective action? Did I take my medicine? Do I need to step outside and take deep breath? Do I need to sleep more? Correct. Those need to be individualized too, because age, among other things, may apply on what your danger zone is. But you need to know your danger zone, and you need to monitor if you think you're going through whatever situation, so you know your triggers, and then have the corrective action so it's not a problem. Corrective action, doctor. How many days should a person wait until calling their doctor if they're in the red zone? Red zone, I mean like really high blood pressure.
Well, soon. I mean, this slide talks about 180/120. It depends on the person. If you have a high blood pressure and you have symptoms, even if it's say 160/85, and you have a headache or vision change or chest pain or something, that's something that needs to be addressed right away. If it's just the number and it happens to be 180, then that deserves a phone call to your doctor, especially if that's new for you. You know, that's the kind of blood pressure that could get you in trouble within days to weeks. Most blood pressure problems we think of as long-term investments in your health. You
Very
know, a blood pressure of 140 over 85 is not going to get anybody in trouble tomorrow or next week, but it may make a real difference over 5 to 10 years. But when you start to see some of these high numbers on the chart, when you see 190 over 90 or 190 over 100, that could be an immediate problem.
Very good. Great point. And also, I see it often too because we do workplace health, and checking blood pressures when people are working is so much fun. I can tell you have very good stories. But one that we come across very often is we're all dehydrated, doctor. So what happens when we're dehydrated? Does our blood pressure go up or does it go down?
You've got to be pretty dehydrated for it to go down. You know, after maybe like an intense workout or, you know, spending a lot of time, we see a fair number of folks spending a lot of time doing yard work this summer, then you can have a low blood pressure and really feel it and kind of be in bad shape. I think on a day-to-day basis, those of us, and I'm guilty of this, and I have to work on this all the time, I never seem to get it right. Busy people tend not to be very well hydrated. And that actually is a stress on the body, and anything that's a stressor can drive blood pressure up. So conversely, or surprisingly maybe, mild dehydration can actually drive blood pressure up.
And yeah, this is why I wanted to point it out. Busy people also like to drink caffeine. I see you drinking water, so good for you, doc, at this time.
Trying,
No, but
I'm a
sometimes
work
we
in
see
progress.
these things, we don't sleep enough, we don't eat very well, we're tired, fatigued, and then, oh gosh, my head hurts. Is it the blood pressure is high? So we just sometimes lose track of which one came first, and sticking to the basics, right? So drinking plenty of water, getting enough rest, and with this kind of, we're gonna lead on some key basics here that may sound redundant, but they're very basic steps or habits for a healthy heart. And I'm going to start with the first one, which is if you do not have a primary care provider, you need to have a to-go person, doctor, physician. And when is the right time, doc, to seek help from a cardiologist?
You know, it's kind of fun actually. In the last few years, we've seen more people come to us, or at least in our practice, we've seen more people come to us for prevention reasons. They haven't yet had a heart problem. Prior to that, it would be, you know, 95% of people who would get to a cardiologist had already had a heart problem. We'd love to see people up front and try to intervene earlier. But so some examples would be if you were having heart symptoms or symptoms that sounded like a heart, for example, chest pain, shortness of breath, tightness in your chest, pressure in your chest, skipping a race in heartbeats, dizziness, these kinds of things. Or, you know, if you have diabetes that's been tough to control and you're concerned about your heart risk, or if you've had high blood pressure and you're already on a that doesn't seem to be controlled and you're looking for a more consistent solution, sometimes cardiologists can be helpful.
Yeah, it's also good to note that you could have a primary care doctor and then a cardiologist be your specialist. Some cardiologists do prevention too, particularly as part. So you have to know your team and then know when to seek out another team player to get best care. One of the things that we suggest, particularly with people that have had a disease, a chronic disease for a long time, that it may be appropriate to reach out to a specialist such as a cardiologist, like if you had diabetes for 20 years, or if you're having issues managing your current cholesterol or blood pressure with your primary care doctor after a reasonable amount of time, you're not being disloyal or you're not being a bad patient if you seek a second opinion or if you seek a specialist consult. Is that correct?
Yes, and I agree with everything.
Management, I think it's called oftentimes.
Yeah, I agree with everything you said. The other thing that we do in our practice is we really encourage people to get second opinions too, just like you might seek a second opinion for, who knows, everything else in our lives, tax issues or, stuff with family or who knows, something related to your car maybe. I think it's totally reasonable to get second opinions regarding your health, including your heart health. We welcome second opinions where people have already seen a cardiologist and they want to just confirm or get a new set of eyes on the problem. Similarly, we actually encourage our patients, our existing patients, to go seek second opinions because it can be really helpful, and we all learn things in the process.
Very good. Okay, next one is keep your weight in check. And I'm going to say here, no matter where you are right now, if you're in a healthy weight, maintaining your current body weight takes effort and dedication. So kudos to you, no matter where you're at. If you have been gaining weight, you have to put a stop to it. Address whatever may be going on in your life to contain the situation. And no matter where you are right now too, if you will benefit greatly anywhere, if you lose 5 to 10%, I want to say the evidence has shown just a very modest weight loss, especially if it's a product of treating yourself better, can have a significant positive impact in overall health, but particularly with cardiovascular health. What about get moving, Doc? You're an athlete. So what's the recommendation for cardiovascular benefit?
The American Heart Association and the American College of Cardiology, my professional group, have really stuck with a recommendation for basically everyone of a minimum of 150 minutes of dedicated exercise per week. So that's 30 minutes a day, 5 days a week, or 40 minutes a day, 4 days a week. And it includes a lot of things. We have some people who have mobility issues, so they can't necessarily walk or use an elliptical machine. Maybe they do chair-based exercises, or they do stretching, or they just don't really like walking, but they love to garden, or they love to do other things outdoors, hiking. All of that counts. But it's really, we spend a lot of time trying to help people work with ways in their busy lives to make exercise a foundational piece of your schedule around which you add everything else. Sometimes we try to think of just try to squeeze exercise in if it works out, if my schedule allows for it. You can't do that. It's got to be a foundational piece to which you add everything else.
I talk a lot about with people too that are too much at home, maybe, and may have too much time on their hands, but they still not move enough for whatever reason. Sometimes also it can be scary for someone that hasn't exercised for a long time, and they may have arthritic pains or shortness of breath, but there's no excuses. I'm going to put a plug here, and wherever you go for healthcare, but for example, at St. Luke's, we have a wonderful cardiac rehab fitness center, and it's a controlled, safe, supervised environment that you can slowly get started into somewhere. So if you are super sedentary and you don't have good strength, overall health is going to be impacted by that. So getting your body to move more, there are ways to do it safely. So don't close your mind to saying that is not for me. And the plug too is cardiovascular fitness is important, but strength training needs to have a space as well. We lose muscle tone as we age. And when we lose muscle tone, other hormonal things occur, and so you're more prone to be insulin resistant, and you just don't look as well too. Your bones are going to be weaker. So thinking about whatever you can do with the force of gravity, it can be a great way to balance out with stretching, balance, cardio, and strength, just to feel super powerful. Eat more plant-based foods. They're not only cholesterol free, they tend to be healthier fats, good protein sources, and really rich on fiber, vitamins, and minerals. Limiting processed foods. Why, doctor? You mentioned the term clean a couple of times, so I want to see what your interpretation is in regards to processed foods versus clean foods.
Sure. Those are, I guess I would call those opposite ends of the spectrum. There are lots of reasons. Plant-based diets, and I'm not advocating necessarily everybody should be vegan or vegetarian. I'm not.
Me neither.
But things that come from the produce section are much more nutritious, and they are much less calorie dense. Whereas highly processed foods, a handful of chicken nuggets versus a handful of spinach there are a lot more calories and sodium in chicken nuggets, as an example. So there's a lot of stuff in there that you don't want, and many things that you don't need in processed food. So we really encourage people to spend more time in the produce section when they're trying to make positive, healthy dietary changes.
And I'm a big advocate, as I'm 50% Italian. You need to spend more time in the kitchen. It's really not that difficult to put a meal together. If you make your own chicken nugget, it's not going to have a lot of the junk, okay, that the highly processed foods have to make it last forever, frozen, tasting crunchy. Who knows? Read ingredients, right? Okay, sleeping better. Once again, we talk about resting and inflammation and how it's all connected with cardiovascular health. And mental health and stress, using tobacco, having a history of tobacco use, or being exposed to secondhand smoking. And I'm not so sure about the literature on vapes and all these new modalities, but all of these things are associated with negative impacts on health. So get support, and we have a lot of support to give you and offer you resources at St. Luke's if you're thinking to quit. Surround yourself with healthy relationships and practice self-love. I think are my favorite ones of this slide. And you were great at emphasizing how important lifestyle is and how important it is to do it for yourself. And that radiates to those around you. It's just, a great way to kind of put a tone to the heart of it all is in your heart and in your self-care. As we're coming here close to the hour, I want to give opportunity to please, if anybody has questions they want to ask at this time or comments, to let me know. We can try unmuting somebody again, since I couldn't do it with Mallory. I have a comment here for you, Dr. Kraft. What will be the average life expectancy for a 75-year-old who has a quadruple bypass surgery?
That's a great question, and I saw that too. I've been thinking about that. So I guess there's really not enough information, and the reason I say it that way is because having had bypass surgery, coronary artery bypass surgery, doesn't necessarily limit length of life. In fact, it can be life extending in certain circumstances. And although a life insurance actuary might have a number in mind about how long somebody should live after bypass surgery, I don't think most cardiologists would. It has a lot to do with other medical problems. It has a ton to do with how has that person managed his life after bypass surgery. Are they an exerciser? How do they eat? How do they manage their stress? What is their blood pressure control? What is their blood sugar diabetes control? All of these things really, really matter. So unfortunately, I don't mean to be evasive, but there is that answer. But the message in that is that it's influenceable, is that you're not necessarily on the clock if you've had a bypass surgery.
Okay, I have Matthew, you had a question. I'm trying to unmute you, and I'm so sorry. I was under the impression that I could, but I can't. Another question came in here. A friend just recently had cardiac arrest with no warning. I have AFib. Is this a risk factor?
Yeah, well, first, let me say I'm so sorry about your friend. So atrial fibrillation is the most common irregular heart rhythm in the adult population in the United States. And we really have, before we all got familiar with terms like pandemics, we really kind of have an epidemic of atrial fibrillation. It is increasing in frequency faster than the population is aging. And we don't exactly know why that is, but many, many people have atrial fibrillation. Atrial fibrillation is a risk factor for problems, including things like stroke, for developing heart failure. So yeah, atrial fibrillation can be a problem. It needs to be managed. Those are the kinds of things for which somebody, I believe, should see a cardiologist. But it's also something that's manageable. Because so many people have it, it comes in lots. It's amazing how many different forms and the way it can affect people differently. But it's manageable. So with careful personal care, self-care, and with the guidance of a cardiologist, you have a good relationship with it. It's something that you can live long and live well with.
And I always add, I'm glad that your friend is talking to you. You don't want to keep this. I mean, it's good to be private, but you also want to let your loved ones or friends know about this, or a coworker, because things can happen unexpectedly. And if someone near you that loves you knows what's going on, they can probably call 911 faster or be able to provide help for you. Linda has another question. She says, "What do you think the cardio mobile systems are worth the expense?"
Great question. CardioMobile, it was a company called AliveCore that was bought by Cardia, and this is for those who aren't familiar, it's a little handheld monitor. Some people even stick them on the back of their phones. You can use 2 fingers or 4 fingers, sometimes even triangulating with a vector in your leg to detect heart rhythms. And it does a fair job. It does a fair job. I have some colleagues who encourage certain patients to get them. It's marketed direct to consumer, meaning to anybody who wants to buy one. I don't personally find them useful most of the time, and so I don't generally recommend them for my patients. There's a select, relatively small group of people who may benefit from one of those, but it's not many. So I would encourage people, and I'm not picking on CardioMobile, there are an increasing number of heart rhythm monitors that are available, including the Apple Watch, for example. Before I would ever encourage somebody to get one of those for medical purposes, I think I'd have that conversation with your doctor who knows you.
Dr. Kraft, since we have just 2 more minutes, I want to make sure that I remind everybody that you're going to get a copy of today's presentation along with an electronic PDF file that it is friendly to any device. So all you have to do is hover over a service line or the name of the program and click on it or tap on it, and it will take you directly to that source. So it's easier to get to that contact. There's also a QR code that you can just, once again, point your phone or your device, and it could take you straight to some of the programs that not only involve what the doctor mentioned with the cardiology line and second opinion and physician referral, but I hope to see you in some of the community outreach events and classes, as long as the fitness center and all these other wonderful things that we have to offer you and support you along the way. If we didn't get to your question, or if you have a question after you review the material, you will have my email. So please don't be shy. You have a friend in St. Luke's. Her name is Glorice. Put me to work, and we will make sure that we connect you with what we need. There will be 3 questions that are going to pop up as soon as I end the event. And we want to make sure too that the attendance prize winners that we're going to mention here shortly with Dawn, you will be contacted by me directly so that we can give you the prices. I want to thank first Dr. Kraft for your time. You are wonderful at explaining things in a way that we can understand and relate. And I hope to have you again to spread the good word about heart disease and raising awareness about this very serious but modifiable condition.
I'd be honored. Thank you for having me. And thanks to everybody who attended. Thanks for being interested in your health.
And I hope the call for action is that you do something different tomorrow once you get this email, okay?